Hello, this is Dr. No with Kid Focused Dentistry. So today we want to put together a video to kind of give the parents what to expect and how to be ready to take care of the kid before and after our tongue tie and lip tie release. We want to address a lot of the concern that parents have because this is such a new procedure that parents a lot of time get overly worried. The good news about this is we are doing it with laser. So the best thing about laser is when we do the procedure, there is no bleeding or very minimal amount of bleeding. It cut down a lot of the swelling, it cut down a lot of the discomfort. So therefore, the healing time is a lot faster, and basically most of our patients, the only time they have to take any kind of Motrin or Tylenol is right afterward. So the first question is, what should you do beforehand? You don't have to do anything. We really want to prepare the child when he or she get into our chair. As we know as parents, a lot of time when the kid's getting the information, they overthink it and it stresses them out too much. So what I want you guys to do is just kind of talk to the kid, say, hey, we're gonna come and see Dr. No. Your tongue is not moving as fast as we like, and she will help that tongue move faster so you can talk better, you can swallow better. Or just say they will talk to you when your child gets here, okay? No need for restriction of any kind of diet. The only thing that we're really gonna use is we're gonna use some nitrous to kind of help calm the kid. And basically, if your kid ever had any kind of work done with us, it's basically the same thing. They're gonna lay down, they're gonna have some nitrous, watch the TV. Depending on how old the kid is, sometimes we will give the kid a little bit of a numbing medications. Again, we will talk to your child about that. The procedure itself is actually lasts anywhere from 1 to 5 minutes. It's really not that much. And then when we use the laser, we do ask if you have other children to kind of keep them in the waiting area. And then just for you to be there with your child. So most of our parents that have gone through this with their child before actually always really surprised how easy everything is. So that's about it for the procedure itself. You can actually go on our website and you can kind of see the pictures pre-op and post-op and how the healing process is. We have all of our post-op instruction on our website, so if that's also helped you, you can do that. So post-op, there's a couple of things that were going on. Number one thing, we do encourage you to give your child a dose of Motrin or Tylenol after the procedure immediately. It will help with the weird sensation of feeling numb, and it's going to help any kind of swelling. Other than that, there's really not much pain management that you need to do. If you need to give an extra dose, you can. We have not really run into that issues. The most important thing that we really want to encourage is 2 things. It's going to take about 10 days for your child's tongue to kind of heal. And during that time, it's very crucial for you to help your child with the exercise that I'm going to show you guys here in a little bit. What this exercise does is it's really going to help the tongue not just has scarring. And that it's going to help it heal a little bit better with a better range of motion. And then after that 10 days, we are also going to send you a set of exercise. The exercise that we use is the first set of exercise that we use for our myofunctional therapy with reteaching the tongue. So this is a really different concept. The whole point why we would have a tongue tie release is the tongue being held down. And that's all your child knows their whole life. And it doesn't have any kind of range of motion. It doesn't really know how to move where it's supposed to. So these set of exercises really to help reset that. And I highly recommend for you to do this with your child. Again, this is something that you will do innately. However, if your child has never had a tongue movement before, so doing it with your child he or she will kind of see how that tongue is supposed to be. And then also doing it with your child holding a mirror in place. Again, I will kind of show this to you in a video too, is for her to kind of visualize where that tongue movement needs to be, okay? So the combination of these two is we're really hoping that now we're giving the child tongue a movement where it's a healthier function on there. And again, if you cannot do this, if it's too hard for you to teach your child, you can always give us a call. We can set up a therapy session to help your child with that kind of movement on there. Alright, so the first set of exercise that we're going to do is just getting the range of motion for your kid's tongue so that the scarring doesn't occur, okay? This is Faith, and she's going to help me demonstrating the exercise right here, okay? So Faith, I'm going to have you sit back right here, and I'm going to show it to you first, okay? And then I want you to do it for me, okay? So the first thing you're going to do is you're going to open wide, and what you're going to do is get your tip right here, move it, tip of your tongue, move it up to the roof of your mouth, up, side, side. And all you have to do is 10 times, 3 times a day and 10 times each time, okay? So, ready? We're gonna try again, okay? We're gonna put up, side, side. And that's 1. Up, side, side. That's 2. So when your child's doing the exercise, probably the first time you can have to supervise your child really well. But after that, what I want your child to do when she's doing the exercise is actually to take a mirror and look into the mirror and see that motion themselves, okay? Because what we want to do is kind of help your child register the motion where it needs to be. So Faith, can you go ahead and do that for me with looking in the mirror, please? Up, side, side, up, side, side. Again. Again, this is so easy, but it does take some commitment. So 3 times a day, the exercise movement is 10 times and for 10 days. So it's pretty straightforward, okay? Your post-op care is we are going to send you this little thing here. What it has in there is coconut oil, okay? So after you kid have done the exercise, what you want to do is just take a little bit on there and put at the base of the tongue. And then once she closed, it's going to melt it into that lesion right there. What it does is it's kind of like Vaseline for the site. It helps it heals a lot faster. It kind of creates this moisture barrier that's going to help the healing process and lessen the chance of scarring again, okay? And if you have a lip tie, you would take the same thing, kind of lift up that lips on there, slide it right under the side of where the lesion is. With lip tie, you don't really need the exercise very much. You do want, when you put in the coconut oil, just kind of slowly rub it a little bit on there, and that will really help that. This procedure is actually a lot less complicated than most parents think it is, but the benefit is amazing, and we really hope that by doing this, you guys will really see the benefit and long-term benefit of your child. Thank you again. You guys can always give us a call if you need anything. We're here to help. If you have additional questions, please give us a call. Check out our website. We have a lot of information that I think would be really helpful for you guys. Okay, thank you.